Passionate areas of my practice is the post-bariatric massive weight loss patient, in which we can perform transformative surgery for the entire body. After someone who has undergone bariatric surgery and has lost anywhere from 80 to, I've seen 200-pound weight loss, patients are much healthier inside, but they are imprisoned by the excess skin that they have. What we can do at the Lucas Center of Plastic Surgery is that we have a series of surgical procedures that have been clinically proven, have been constantly evolving since 2005, and we feel that we can provide patients an experience that will make them feel completely transformed after their weight loss surgery. One of the first steps that we look at is what I call the keystone area of the body, and it's the lower abdomen, flanks, lateral thighs, and buttock region. Unfortunately, a lot of people get trapped within a weight loss center, which they are extremely good at in performing bariatric procedures, but they want to limit your rehabilitation to just a paniculectomy. That really looks at only addressing the lower abdomen, doesn't do anything for the pelvis, it doesn't do anything for the lateral thighs, it doesn't do anything for the flanks or the buttock area. So it's really a one or two dimensional procedure when you really need all three dimensions worked on. This operation really is a combination of an abdominoplasty, 2, a lateral thigh lift, 3, gluteal enhancements, in which we use tissue that would be thrown away normally in the flanks, turned under, reshaped to look just like the gluteal muscle, and then perform the kind of a Brazilian buttock lift, if you would. And this operation can completely change the way someone can wear clothing and feel it even in a bathing suit. And it allows us to address all those areas at one single time. The beauty is it's all done as an outpatient surgery. It does take several weeks to recover, but it's a very successful operation. The next area that we typically would address is what I call an upper body lift. And that generally, if we're talking a woman, is addressing the breast, which changed dramatically after losing 100 pounds, where the breast begins to sag, flatten, the nipple-riller complexes go towards the center, and there is no shape at all. And in many cases, the fold has dropped as well. So in that procedure, we are ideally doing a lift only. If you have tissue, if you don't have enough, we're having to do a combination of a lift and an enhancement with an implant. Now, that is a complex operation, and it typically takes 2 stages to get the final result that we wish. Then at the same time, we will address your upper arms, which typically have a lot of excess skin that hangs. And we can get that to a nice, crisp, firm arm contour. It does require a scar that kind of transcends from your elbow in the posterior aspect of the arm, goes down, and then I extend that to correct the lateral chest wall. This helps get rid of excess skin of the back and the side, and eliminates any hang that would go over a bra. So that component with breast and arms and lateral chest, that does a wonderful transformation of your upper body. The third step is typically a medial thigh lift. And many people, despite having the lateral lift of the circumferential body lift, they need the medial thigh addressed as well. And that is where we essentially, in 2 different vectors, we are closing it horizontally and lifting it vertically into the groin crease. And that can give a much improved shape that can go from the knee all the way up to the groin. And that also can make you feel much more comfortable in clothing and make you feel much more comfortable. Then lastly, particularly if it's an older individual that has undergone the procedure is to have a neck lift as well. And there are differences in technique that we use on a post-bariatric person as opposed to just a traditional person wishing a facelift. There are some technique differences, but it can do a wonderful job of giving you a neckline back, giving you a crisp neck, and that also can give you the appearance of additional weight loss. So at the Lucas Center, we offer all these procedures that can help make a person feel whole again and feel that they can rejoice after having undergone all the burdens of having weight loss surgery and all the arduous steps of changing your lifestyle to get to a healthy state. And now we can make your body look the same healthy way.